time for In Focus. I made you a promise the other day and said that on Monday we're going to continue with that same topic. We're talking about social protection. It's a very, very important intervention, and we have actually neglected it, especially when it comes to the media. But we have decided to champion this area when it comes to social protection. Even when my guest is gone, we would have to talk about social protection. The other time we looked at the challenges. We'll do a recap quickly, and then we'll look at the solutions and why. Or there's another part that I'm going to say that as the social interventions and the social protection actually get into the very people that it's supposed to get to. And the policies, are we really dealing with it? My guest, once again, is Mr. Richard Akwete Ejete. Mr. Ejete, thank you very much.
Welcome.
Thank you. Wow. How's your weekend?
Quite okay.
You're looking forward to this midweek, going
yes.
on a trip somewhere that I would go.
Yeah.
But let's come back to the topic that we started with the other day, social protection, and do a recap of what we started with last week, maybe in about a minute or two, and then we'll start with today's main subject, which is actually the solutions to our social protection area.
Yeah, basically, the last week we were talking about the need for social protection interventions as a response to vulnerability and poverty in Ghana. And I quite remember I added that governments have done very well to safeguard the spending on these social protection interventions by increasing budget allocation for these interventions. Right. But there's a but as to whether these interventions really benefits the poorest of the poor for which intended to.
And so you even gave us the population of the poorest.
Yes, I went on to say that when you, currently, if you look at JFS 6, the extreme poor population in Ghana is about 8.4%. Right. But currently, it has increased to about 10%. It means that if you project our population of 30 million, we are having about 3 million being in the extreme poor population. Wow. And that is the population, and that is the population that cannot meet their basic human needs vis-a-vis their nutritional requirements. And so that is worrisome in the area of social protection.
Social protection. Yeah. Right. And so once you're done with this, let's look at some of the interventions. And do we have any policies in regards to social protection, even before I go into the solution? Excuse me. Do we have any policies regarding social protection before I go into the solution?
Yes, we have numerous policies in every phenomenon in social protection dimension. For instance, we have the child and welfare policy. Okay. We have the national gender policy, 2014. Okay. We have the national environmental policy, 2014. We have the climatic change policy, 2014. We have the national youth policy. We have the aging policy.
So they are policies.
They are policies, and we even 2016 we developed the national social protection policy.
You were part of that.
Yes, I was.
Because that's when you exited in 2016.
Yes, exactly. I was very instrumental in that policy. And the objective of that policy was to deliver a very comprehensive and integrative social protection system that will respond to vulnerability and poverty in the country. Right. So we developed that policy.
Have we done anything with that policy?
No. From 2016 to date, we have not seen any comprehensive implementation plan regard to the policy.
From 2016?
Yes, to 2016. 2016. And one thing that is happening currently is that, for us to have an expansion on social protection provisions, then we must be able to have effective institutional arrangements and governance structures.
You don't just do it anyhow.
As well as intersectorial linkages among the various ministries. And that's the bigger issue. We don't have it. Okay. In 2016, before I left office, I helped to develop what you call the institutional arrangement framework, which look at the governance of social protection, including both all the ATEX. Okay. And as at to date, from my record, what I've heard was that out of the 275 districts we have,
which of course we have 275 districts, right?
Only 13 have been trained.
What?
On this institutional framework.
Are you kidding me?
Yes. And so you
out of 275 districts,
only 13.
1-3.
And so where you have this going on, and these institutional arrangements it's very crucial to expand the social protection provisions to these vulnerable groups. And so where the institutional arena is not operationalized in the various districts, then you are going to have a challenge.
But if this is a situation where since 2016 till date, which is 3 years down the line, I mean, because we're halfway into the year, and so I can still use, I don't know what time it did actually happen when you exited, but if it's 3 years, and out of 275 districts, just 13 been dealt with, what solutions then do we have?
Yes, and so before I come back to the solution, I mean, in 2016, when I exited office, we tried to enact the Social Protection Bill. The idea for the bill was to have a clear legal entitlement and a long-term commitment of resources. That was the idea for the bill. As I speak today, the bill still have not received cabinet approval or as well as parliamentary consent.
So it was when the previous administration had were exiting, is when this was actually.
Yes, that's when this started. But the question is that it's not about who starts and who to when.
I'm doing this in the sense that it means that one administration had gone, another one is coming. If we're not careful, when this also would exit, another one would come in, and the bill will still be lying there because you said that it hasn't been given cabinet approval.
Yeah, it has not been given cabinet approval.
How long does it take for things like this to?
Well, I can't
tell because you're not a cabinet.
And so it's a very big issue. It's a very really big issue.
And two issues here has actually drawn my attention to something that if this is how we're dealing with social protection, then we should say we don't have solutions. Because of the 13 out of 275, and a document that has to go through cabinet hasn't even received cabinet approval for it to become a legal document. How then do we go forward and say we're pushing for solutions? But all the same, I still want to hear what kind of solutions.
So what basically is happening is that in delay of these things, the implementation plan, the drafts bill being delayed and all those stuff, it's all boiled about capacity.
Right.
We need to strengthen the capacity in design and delivery of social protection. If you don't build the capacity, for instance, this is what sometimes I argue about. I keep on saying that social protection is a specialized area, and we must not put politics into it. We must be able to have people who have the requisite knowledge and the skills to help design and deliver social protection. For instance, currently, if you look at, we have social welfare services programs. We have social welfare service programs, which we call it child protection programs.
Right. Child protection programs.
As a result of child trafficking, child labor, streetism, that is we are having currently in Ghana. As I speak the last time with you, I was saying that if you take something like streetism, currently we have about almost 400,000 persons on the streets.
On the street, 400,000.
Yes, in about 9 categories. And so, for instance, when I went to Department of Social Welfare, I helped to design operational activities regard to this streetism. So when the person don't have the capacity to design and deliver, these are some of the challenges that we faced. Apart from that, we also need to strengthen our intersectoral linkages, sectoral collaboration.
What is preventing us?
It's all boiled about capacity. Once again, it's boiled about capacity. Why am I saying that? When you have an effective intersectoral linkages of the various sectors that are implementing social protection, then you'll be able to improve your complementarities. As well, the linkage from the national to the sub-national level. But when that has not happened, then you are not seeing that the benefit of social protection will not go down to those who are supposed to benefit.
Would you be kind enough to tell my viewers which ministries, a few of them, that play that role in terms of being part of, who actually deal with social protection? Some of the ministries, the gender ministry.
Basically, the gender ministry have the oversight strategic responsibility to play, as well as monitoring and coordination of these social protection interventions. But it works in conjunction with other sectors like Ministry of Health, Ministry of Agriculture, Ministry of Education, Ministry of Local Government and Rural Development, Ministry of Environment and Science. It works with all these.
So it cuts almost.
It cuts across, as well as the donor and non-governmental, as well as non-artists like the chiefs, opinion leaders, and all those staff all work in that particular area.
So almost everybody.
Yeah, everybody is supposed to work in that area. Yeah.
Wow.
And so that is the issue. And so we need to strengthen that capacity. And when we don't strengthen these intersectorial linkages, it really affects what we call the complementarity framework. You know, social protection is not necessarily about providing the cash or the income to the vulnerable households. You are also supposed to empower their livelihoods and make sure that you promote access to social services among these households to build their capacity.
And all that was written in the document.
Yes, and all that are there. So the question is that if you don't develop the intersectorial linkages, then you cannot promote complementarities.
So you're dealing with it anyhow.
And so there's no way the poor will have access to these social interventions. And that's why I give TK example. If you take livelihood empowerment against
I was going to
poverty,
ask you about that.
the livelihood empowerment currently, as I speak, is have a coverage of about 350,000 households.
Okay.
Which when you permutate it or analyze it, they are covering 11.6% of the current total population of the extreme poor.
Okay, of the
extreme
30 million.
Yes.
Of the 30 million.
Of the 30 million population we have, 3 million fall within the category of extreme poor.
Okay.
And LIP is just covering 11.
That's a big difference.
Yes, so we need
11% of the 3 million.
Yes.
Extreme poor.
Yes, 11.6%.
Wow.
And the same applies even when you look at the National Health Insurance Scheme. As I speak, National Insurance Scheme is covering the total population of 42%. And of that, only 12.5% are covered by the indigents. And if you look at the extreme poor, the livelihood empowerment against poverty beneficiaries.
I'm even tired.
You shouldn't be tired.
Honestly.
So
you're talking about, a percentage out of a population of what, 30 million?
30 million.
The National Health Insurance is covering 42%. And out of the 42%,
42%, only 12.5% are covered by the indigents.
Why wouldn't I get tired?
No.
No. Are we just paying lip service to social protection?
No, we are not. And that's what I'm saying, that when we don't strengthen the institutional arrangements. Vis-a-vis intersectoral collaboration, these are some of the things that we see. Again, we must have what we call an improved program design and monitoring and evaluation to be able to have a maximum effects and equity on these social protection interventions. The MAE framework within that. When I left office in 2016, I helped to design. I even published something on it about the MAE framework on social protection. I published an article regard to that area, and I mentioned a lot of indicators that we need to look at to be able to measure the effectiveness of this intervention and its beneficial impacts as well. To date, we are still grumbling. I don't know whether we have that framework being fully developed or not. I can't tell. And so these are some of the challenges we have.
Well, you just took the word out of my mouth. What are some of the challenges that prevents us from doing what is right? And it seems as if we go around in circles. And when we find there's a challenge here, then we end up trying to find solution to it. But you cannot stand in the midst of tongues and pretend as if you're removing it, because you're still standing in the middle.
And so these are some of the challenge. And the last week too, when I was talking, I mentioned about when you look at the livelihood empowerment against poverty.
Yes.
There's something that we call the graduation and exit model.
Okay.
That I mentioned that down the lane about 11 years that we started implementation of the livelihood empowerment against poverty. That particular component of it have not been implemented. And so you find the same old people, either by proxy or anything, still on a program. And the very, very poor who are supposed to benefit from these programs are not getting on it.
Because somebody has become a Methuselah.
So we are finding both the inclusion and exclusion error becoming more and more. And that is really worrisome. And that is why I'm emphasizing, I give credence to your station, that we must be able also to strengthen the capacity initiatives of the media as well as non-governmental actors in the area of social protection.
Yeah.
We are not doing that. It's a, it look as if the media is quiet on social protection. We must be able to dissect the policy, look at what the policy contains, what the policy intended to, what are the objectives, what are the framework, what are the roadmap in the policy. We must all look at those things.
So that we're able to find out if something is going wrong, why this is not being done, because it's in the document that this is what we're supposed to do.
Because, for instance, if you pick the Ghana school feeding program,
Yes.
for instance, government have increased the child benefits package to 25%.
Right.
Again, if you look at the program have improved, or the coverage have increased from 1.7 million to 2.1%.
Right.
So, I mean, the government is really doing much effort in terms of resources
For the school feeding.
for school feeding,
Right.
as well as some of the intervention. But the question is, are we monitoring these interventions?
Because do we even have an idea what is happening there?
Yes. And so these are some of the bigger challenges that we are facing when it comes to the implementation of social protection in Ghana.
But can you even blame the media? Because the job that is supposed to feed us with information so we can pass it on, they will choose to go stand in the press conference somewhere and answer their own questions, and they'll make a mess of it. So you can't also blame the media.
No, but yes, I can't bring the media.
Because you, as an individual, in your own capacity, look at how much information you're passing on to the Ghanaian populace. But if a ministry is responsible for social protection, as an oversight ministry, would not send to me, but choose to go and meet the press and just talk for 20 minutes or 30 minutes, what can you do?
Well, I agree with you, but elsewhere, if you take countries that are implementing very comprehensive social protection, like Bolsa Familia in Brazil, if you look at the safety net in Ethiopia,
okay.
as well as Tanzania, the media play a very active role.
Because they get involved with the whoever is responsible. Because I can't, you see, we're in a state where, I mean, I can't have information for certain places because they themselves do not have that, especially the way we select people into various ministries. And that's why people have the terminology here that square pegs are in round holes. The person himself responsible for the thing does not have a clue about what the area is. And this is my personal opinion anyway.
Yeah.
And in the end, they think that everything must be politicized. And so they will choose to go and stand there and paint everything good, even when there are challenges that we can tell the people that, look, we are in together, let's hold hands, let's do this. But they want to paint a picture that everything is beautiful. Unfortunately, like you said, the numbers are dwindling. People who are on the program have remained there for a very long time.
For a very long time.
And instead of exiting or probably getting them to have some kind of a trade or something so that they can make a living and exit for other people to join, people have become stagnant.
Yeah.
In the pipeline.
Yeah.
Like we say.
So that's what I keep on saying, that on the part of the government have done very well. For instance, again, if you take the capitation grant,
Okay.
the grant have increased from 4.5 cities to 10 cities.
Okay.
And so it means that in government,
For the capitation grant.
grants,
Okay.
governments have also done very
What
well.
about the LEAP?
The LEAP, yes, governments have the LEAP increased from in 2016 when I left office, the LEAP was around 260,000 households. Today it's about 350,000 households.
We could have done more.
We could have done more because when you look at the extreme poor population of about 3 million people or 3 million persons,
Yeah.
and you are just having 350,000, and you're looking at the inequality gap now, where the inequality gap now, especially in the three northern parts, and you are finding people finding it very difficult to meet their basic human needs.
I look at people on the Afram Plains area
And
even the central region, because
Yes.
if you travel on the coastal area from Apam all the way to like Elmina and beyond, you could tell that poverty is as white as anything.
Yes, and as I mentioned to you the last week too, I mentioned to you that the reduction in poverty has become stagnant. In spite of that Ghana have the transformation agenda. You know, social protection is a key strategy in the transformation agenda. That is the coordinated programs for social and economic policies is a key strategy. And so government knows, and that is why government have safeguarded that particular spending of it. But the program implementers and how we be able to coordinate these social protection intervention is a problem.
Is it because the people have no idea about what they themselves are doing, or they know but they just choose to do it anyhow?
It's the capacity. We don't really actually have the capacity in area of social protection. I must say it. You normally have people who you vis-a-vis train them for minimum and they feel they have the capacity. They don't have the education background. They
But
don't have the
here.
experience.
Why is government not talking to you?
Well,
Oh, that's another question.
it's another question.
I think we should begin to advocate that persons like you should not go waste. Seriously. From the time that I met you, the amount of information that I have gathered in my little bank in regards to social protection in that aspect, it's unbelievable.
Yes, maybe because it's my area of specialty,
Yeah.
and I have worked for over more than 16 years in that area.
Okay.
So I have much information, and day in, day out, I'm doing a lot of research in the area of social protection.
But
to
you
see-
should be a consultant for the state in the
Well,
area of social protection.
Well, it's a good idea. And for instance, this is what I put on record. When it comes to what we call complementary framework, that was my master's thesis
Okay.
in complementary of social protection programs. And you could see that you have the staff, but nobody is approaching you to tap what you have. And so it becomes worrisome. And even when you want to put out information, you realize even when they organize meetings and programs and workshop on social protection, where you expect at least you could be brought on board to put on your
Information. And the knowledge that you have.
you are not being given the chance. And these are some of the things that worry some of us and ask that. Then what is the essence of you having developed your capacity in the area of social protection? And that is what is going on. So when you go to these programs that we have, you see the number increasing. But the question is that, is it really benefiting the extreme poor? That is the question.
Is it really benefiting
the
the
extreme
extreme poor, who that intervention was meant
Amendment for. They are not actually benefiting. And so we need to go back again on the drawing board and have a very comprehensive implementation plan.
I don't know the number of times that we'll have to go to the drawing board. But
We
from
need-
a simple thing that if persons like you are not being consulted, the future doesn't look bright.
Wow.
Because in many areas, and I'm not saying it because you're here,
Yeah.
from the amount of information that you have just passed on from last week to today, and yet when it comes to state functions and all that you can even go give a little lecture that somebody will tap into it, they've left it. If you have a blank check or you have a signed check and you don't walk to the bank, it's not money. But here you are. But there are people working, they're talking about social protection. But this is the bank.
Well, yeah, I agree with you what you are saying. But the question is that, yes, that's why I keep on saying that we must strengthen the capacity to design and deliver social protection in Ghana. If only we want to have a very comprehensive and integrated social protection system. It is very crucial.
But you still think there's a future?
Oh, there's
when
a
it comes
future.
to-
There's a future because governments, in the area of government is doing very well when it comes to supporting social protection investments. Government
Is it not
doing well.
political?
No.
You don't think so?
No.
Because sometimes the way they bring in the policies...
The only
and the-
political
yeah.
component that you see in it is where, in the area of targeting, for instance, where a particular district or a community will be enrolled on a program based on political influence. But even that one, when you run your permutations analysis, it's insignificant. Because if you take livelihood empowerment against poverty, for example,
Which is a leap.
yes, they have a very robust MI system,
Okay.
which rank beneficiaries.
When you talk about MI, what do you mean?
The management information system
Okay.
that rank the beneficiaries, and those who actually have the priority are covered by the program.
program.
And so it is very difficult for you to say, oh, Adwa was enrolled on the program because of his uncle is a...
Would I be right if I say that, land on that one, his uncle was what?
His uncle is maybe he's a MP, so the uncle interfered and Adwa was put on the program. No,
it doesn't work.
No, it
that
doesn't
way.
work that way.
Fantastic. But let me come back to the point where I'm looking at it that because we don't have a national policy, so depending on which government that comes in, they pick and choose what they want to do.
No, we have a national policy on social protection.
Do we?
Yes, we have.
And do we follow that?
No, I don't think we are following it.
That's what I'm saying. That
Yes,
if
we are
there
not
was a
following it.
national policy that we would have to follow and say this is how we have to do it. We have this as our main objective. We want to accomplish this, and then we move to this one. But it looks as if whoever comes in will jump and say, I'm doing that because this is what suits me and this is what would make me popular.
No. The issue is that we have the National Social Protection Policy in place. But if you design a policy, the policy must be accompanied with implementation plan.
Okay.
And developing the implementation plan to operationalize that plan need a capacity. Somebody who understands program design and implementation and delivery, which we are lacking.
Okay.
And so you find people being enrolled or being employed into the office as a director for social protection, as a coordinator for social protection, but the person don't have the capacity to design. All the person does is workshop meetings and those stuff. But as a social protection specialist or as a person coordinator or a director, you must have the capacity to design and deliver the program.
That's why you're there.
Yeah, that's why you are there.
Hired to do.
Yes, but the only thing you find some of them is organizing meetings and organizing these monitoring things. That ends there. So you see government pumping the money, but you are not seeing the benefits
on the ground.
Yes, that's it.
We have just about 62 seconds to vanish from this scene. What would you say in conclusion? Because I want you to paint
what I want to say
on the solution.
What I want to say is that regard to social protection in Ghana, we must not stop talking. And somebody like myself will not stop talking because it's very crucial and they're very key strategic in our transformative agenda.
Right.
And so, to me, even when I've been silent or I'm not given the chance, I will still keep on talking about it.
And you're talking.
Yeah, I'm talking. And I want the media also to support in that direction so that people will know whether these interventions are really benefiting the extreme poor.
I'm definitely.
And I borrow my final thing from Kunto and Van Dijis in their studies, where they say that when you rank the National Health Insurance Scheme, you find only the extreme poor being covered 17.6%, and they reach 44.4%. That is why.
And why was the intervention made?
There was intervention made.
Richard Adjetey.
Thank you.
Akweta Adjetey.
Yes.
I'll have you once again very soon.
Thank you.
We have made it a point that we want to talk about social protection.
Yeah.
It is very, very crucial in our settings.
Yeah.
Well, this is where we draw the curtain on today's edition of In Focus, where we're looking at social protection. I'll take a break and we'll be back.